Hey everyone, and welcome back to the Vital Signpost. Being a nurse, especially one of us who's been at it a while, we see a lot, but sometimes I feel like men's health is a bit neglected.
Oh, absolutely. It's such a crucial aspect of overall well-being, and yet it often gets overshadowed.
Exactly. So today we're doing a deep dive into men's health, focusing on the male reproductive system and the common medications you're bound to encounter.
Think of this as your quick reference guide to the essentials, brushing up on the anatomy, the key drugs, and those nursing considerations that'll really help you provide top-notch care.
Okay, so let's start with the basics. We've got the testes, those oval-shaped glands hanging out in the scrotal sac. Their main job is producing sperm, and of course that powerhouse hormone testosterone.
Ah, testosterone. It often gets labeled as the male hormone, but it's much more than that. It has this androgenic action, which means it's responsible for those classic male characteristics. We're talking prostate development, seminal vesicles, even that beard you might be sporting.
And then there's the anabolic side of testosterone, the one that helps build up tissues like muscle and bone. I'm sure you've seen how testosterone levels can really impact a man's physical strength and even their mood.
Absolutely. And here's a cool connection to what we've talked about before. Remember erythropoiesis, the production of red blood cells? Well, testosterone plays a part there too. It shows just how interconnected our body systems really are. And here's another fun fact. Testosterone levels actually fluctuate throughout the day.
Good point to remember, those peaks and valleys throughout the day. Now, what happens when those testosterone levels dip too low? We're talking testosterone deficiency, which can really affect a man's life fatigue, low libido, even some mood changes.
And to get those levels back up, we often turn to exogenous testosterone, basically giving the body a little boost from an outside source. Now, there are different ways to administer testosterone, but that oral route can be tricky because of the first pass effect.
Yeah, the liver can metabolize a big chunk of the drug before it even reaches the bloodstream. That's where transdermal options come in handy, like patches and gels, which bypass the liver and deliver testosterone directly through the skin.
The really neat thing about those patches is that they're designed to mimic the natural fluctuations in testosterone levels we talk about. It's a much more sophisticated approach compared to a single large dose from an injection.
Clever, right? But we can't forget about safety. All testosterone products, regardless of how they're administered, come with a black box warning from the FDA. That's their most serious alert. And it highlights the risk of blood clots with testosterone use. So as nurses, we need to be super vigilant about monitoring our patients.
Absolutely. That black box warning is nothing to take lightly. Now, while we're on the topic of testosterone, we should touch on a more controversial side, anabolic steroids. These are synthetic versions of testosterone, often tweaked to enhance those muscle-building effects.
And while we often associate anabolic steroids with athletes trying to gain an edge, they do have legitimate medical uses. Things like treating certain types of anemia or helping patients regain weight after severe trauma. It's not all about bulking up.
You're right, but misuse is a serious concern. The potential consequences are pretty scary: infertility, cardiovascular disease, even liver cancer. Infertility is a big one. Those steroids can disrupt the body's natural hormone production, leading to a drop in sperm count, and sometimes the damage is irreversible.
And then there's the toll it takes on the cardiovascular system. Anabolic steroid abuse can elevate blood pressure, send that bad cholesterol through the roof, and even damage the heart muscle. Plus, long-term use puts a huge strain on the liver, increasing the risk of liver tumors.
And this brings us to an important ethical consideration for nurses. We care for all our patients, regardless of their choices, but how do we navigate those situations where their choices involve misusing substances like anabolic steroids?
It's tricky, right? It is a balancing act. We need to draw on our knowledge, our compassion, and our professional judgment to figure out what's best for each patient. Okay, let's move on to a condition that affects many men as they age. Benign prostatic hyperplasia, or BPH. Basically, the prostate gland, that little walnut-shaped gland below the bladder, starts to enlarge.
And while it's not cancerous, it can cause some really uncomfortable urinary symptoms. You see, the prostate, which normally helps produce semen, starts to press on the urethra as it grows.
So that pressure on the urethra is what leads to those classic BPH symptoms: difficulty starting and stopping urine flow, frequent trips to the bathroom, especially at night. It can really impact a man's quality of life.
Absolutely, and it's so common. One way to manage BPH is with medications called 5-alpha reductase inhibitors. A popular example is finasteride, which you might know by the brand name Propecia. It's really fascinating how it works.
Right. Finasteride blocks the conversion of testosterone to DHT, or dihydrotestosterone, a more potent form of testosterone that's a major driver of prostate growth. By lowering DHT, finasteride can help shrink the prostate, making those urinary symptoms much more manageable.
And here's where it gets even more interesting. DHT doesn't just affect prostate size, it also influences other male characteristics, like hair growth. That's why finasteride is also used to treat male pattern baldness.
So the same drug that can help with an enlarged prostate can also help a man keep his hair. Pretty amazing. And there's another important point for us as nurses. Finasteride can lower PSA levels, which can sometimes be tricky when it comes to prostate cancer screening.
Exactly. PSA, or prostate-specific antigen, is a protein produced by the prostate, and elevated levels can be a sign of prostate cancer. Doctors often use PSA tests as a screening tool, but if a patient is on finasteride, those PSA levels might be artificially low. We need to keep that in mind when interpreting those results.
That makes sense. Okay, let's move on to another sensitive but super important topic. Erectile dysfunction, or ED. It affects millions of men and can really impact their self-esteem and relationships.
ED is basically the inability to achieve or maintain an erection that's firm enough for sexual intercourse. There are all sorts of contributing factors, from medical conditions to psychological issues and even certain medications. It's often a source of embarrassment and frustration for men.
Absolutely, and thankfully there are effective treatments. One of the most well-known is sildenafil, better known as Viagra. It's part of a group of drugs called phosphodiesterase inhibitors, which work by increasing blood flow to the penis.
To really understand how it works, we need to dig a little deeper. When a man is sexually aroused, his body releases a chemical messenger called nitric oxide. Nitric oxide then triggers the production of another chemical called cyclic GMP, which relaxes the smooth muscles in the penis, allowing more blood to flow in.
And that's where those phosphodiesterase inhibitors come in. They block an enzyme called phosphodiesterase type 5, or PDE5, which normally breaks down cyclic GMP. So by inhibiting PDE5, these drugs allow cyclic GMP to build up, leading to a stronger, longer-lasting erection.
Think of it like putting a stop sign in front of the enzyme that wants to take down that erection. It's pretty ingenious.
Very ingenious. Sildenafil is one option, but there are others out there, each with slightly different durations of action. For instance, tadalafil, or Cialis, has a much longer half-life than sildenafil, so its effects can last for up to 36 hours.
And then you have vardenafil, also known as Levitra, which acts similarly to sildenafil in terms of how fast it kicks in and how long it lasts. The choice of which drug to use often comes down to individual patient preference and how they respond.
And not every man will respond to those phosphodiesterase inhibitors. Some might need alternatives, like alprostadil, which is injected directly into the penis or inserted into the urethra. It works by relaxing those smooth muscles and increasing blood flow, but through a different mechanism.
But before we go any further with treatment options, we need to talk about a major contraindication with those phosphodiesterase inhibitors: nitrates. Medications like nitroglycerin are commonly prescribed for chest pain and heart conditions. But taking nitrates along with those ED drugs can cause a dangerous drop in blood pressure.
You're right, it's a potentially life-threatening interaction. Checking a patient's medication list before giving any ED drug is absolutely crucial. Now, let's bring all this back to you, the nurse. What does all this information about the male reproductive system and these common medications mean for your practice?
Well, when it comes to men's reproductive health, a thorough assessment is key. We're talking a detailed medical history, but also really listening to their symptoms. Are they having trouble urinating, changes in their libido, experiencing mood swings? All those details can give us valuable clues about what might be going on.
And don't forget those physical assessments. A digital rectal exam can help us assess the prostate, and a urinalysis can give us information about kidney function and potential infections. And of course, monitoring PSA levels, especially in older men, is crucial.
And with testosterone therapy, safety is paramount. We already talked about the risk of blood clots, but monitoring liver function is also super important. Testosterone can sometimes cause liver damage, so regular blood tests are a must.
And we can't overstate the importance of patient education. Patients need to understand the potential side effects of their medications, why regular checkups are so important, and any potential drug interactions. This is where our communication skills as nurses really come into play. We need to explain these complex medical concepts clearly and simply, making sure our patients feel informed and involved in their own care.
Patient education goes beyond just reciting a list of side effects. It's about understanding each individual, their concerns, their lifestyle. For instance, if a patient is taking finasteride for BPH, we need to explain that it might take several months to see the full effects. Or if they're using a testosterone gel, we need to stress the importance of washing their hands thoroughly after application to prevent accidental transfer to others.
It's about connecting the science to their real-life experiences. I remember this one patient who was prescribed sildenafil, but didn't quite get how it worked. He thought it would just automatically give him an erection, whether he was aroused or not.
Oh, I've had patients like that too. It's those misconceptions that we need to address, making sure we tailor our education to each person. Clear communication, empathy, and being willing to answer any and all questions are so important. And, we were talking about those PSA levels and finasteride last time. It's a bit of a head scratcher, right?
It really is, because we know that a high PSA can be a sign of trouble, but what about when it's low in someone taking a medication that can actually suppress those levels?
Exactly. It's one of those situations where medications can make interpreting test results tricky. So let's dig a little deeper. Finasteride, as we talked about, works by blocking the conversion of testosterone to DHT. And DHT is a major player in prostate growth.
Right, so by lowering DHT levels, finasteride can shrink the prostate and help with those pesky urinary symptoms of BPH.
Exactly. But, and this is the important part, finasteride can also lower PSA levels, which can create a bit of a puzzle when we're trying to screen for prostate cancer.
So if a patient's on finasteride and his PSA is low, can we just assume everything's okay?
Not necessarily. While finasteride can significantly reduce PSA levels, it doesn't eliminate the risk of prostate cancer entirely. A man taking finasteride could still develop prostate cancer, and his PSA might not rise as much as it would in someone not taking the medication.
Ah, I see. So we can't just breathe a sigh of relief just because the PSA is low. So what should we be doing differently in these cases?
Well, it all comes down to good clinical judgment and careful monitoring. If a patient on finasteride has a low PSA, we need to consider his overall risk factors for prostate cancer, things like his age, family history, and race.
So for example, if he has a strong family history of prostate cancer, or he's African American, which we know increases the risk, we might need to be more cautious, even with a low PSA.
Precisely. In those situations, it's worth talking to the patient about additional screening options, like a digital rectal exam or even a prostate biopsy. The key is to tailor the approach to each patient's specific situation.
And that's a perfect example of why good communication between the healthcare team and the patient is so important. We need to make sure the patient understands that a low PSA doesn't automatically mean there's no risk, especially when they're taking finasteride.
Absolutely. Being transparent is crucial. The patient needs to know that even with a low PSA, there's still a possibility of prostate cancer, and regular follow-ups are essential. We also need to encourage them to tell us about any new or worsening urinary symptoms they experience.
These conversations can be a bit delicate, especially given the anxieties surrounding prostate cancer. How can we as nurses approach these discussions with sensitivity and empathy?
It's really about creating that safe space for the patient, letting them know they can express their concerns and ask questions without feeling judged. We need to truly listen, acknowledge their feelings, and give them accurate, up-to-date information without overwhelming them with medical jargon.
Sometimes a simple analogy can help explain a complex concept. We could say that finasteride is like turning down the volume on a radio. It doesn't completely mute the music, but it makes it harder to hear. Similarly, finasteride lowers PSA levels, but it doesn't completely erase the possibility of prostate cancer.
That's a great analogy. It helps to make things clearer and less scary for the patient. And it emphasizes the importance of staying vigilant and continuing with those regular checkups.
Which brings us back to that core principle of nursing advocating for our patients. We need to make sure they have the knowledge and support to make informed decisions about their health.
Well said. And it's not just about providing information, it's about empowering them to be active participants in their care, encouraging them to ask questions, share their concerns, and even seek a second opinion if they feel it's necessary.
So to sum it up, when it comes to a patient taking finasteride and having a low PSA, we shouldn't jump to conclusions. We need to consider their individual risk factors, talk about additional screening if it's warranted, and most importantly, keep those lines of communication open and honest.
Exactly. Now let's move on to another crucial area of men's health. Sexual dysfunction. We touched on this briefly before when we talked about ED and medications like sildenafil. But the reality is that sexual dysfunction is a much broader topic.
It's a subject many people find difficult to discuss, even with their healthcare providers. But it's a fundamental part of men's well-being, and we can't shy away from it. So let's explore this complex area a bit more, looking at its various forms and the available treatment options.
When we talk about sexual dysfunction, we're essentially talking about any problem that prevents someone from experiencing sexual satisfaction. This could include issues with desire, arousal, orgasm, or even pain during intercourse. And it's important to remember that sexual dysfunction isn't always just a physical issue. Psychological factors can play a big role too.
That's an important point. So it's not just about whether or not a man can get an erection, it's about his overall sense of sexual well-being.
Exactly. A man might be physically capable of having an erection, but still struggle with desire or arousal. This can be due to things like stress, anxiety, relationship problems, or even underlying medical conditions like depression.
So it's a complex interplay of physical, psychological, and even social factors.
Absolutely. And that complexity is reflected in the many different types of sexual dysfunction that men can experience. For instance, some men struggle with premature ejaculation where they climax too quickly. Others might have delayed ejaculation, finding it difficult or impossible to reach orgasm. And then there's hypoactive sexual desire disorder, where a man consistently has a low libido.
It seems like there's a whole spectrum of challenges that can arise. And I imagine each type of dysfunction needs a different approach to treatment.
You're right, there's no one-size-fits-all solution. The first step is to figure out what's causing the dysfunction. This usually involves a thorough medical history, a physical exam, and sometimes even a psychological evaluation. Once we understand the root of the problem, we can create a treatment plan. This might involve medication, therapy, lifestyle modifications, or a combination of approaches.
So it's about taking a holistic approach, considering all aspects of the patient's life and experiences.
Exactly. And it's crucial to remember that seeking help for sexual dysfunction is nothing to be ashamed of. It's a common issue, and there are effective treatments available.
It's such an important message to get across. We need to normalize these conversations and encourage men to reach out for help. And nurses play a vital role in this. We're often the first point of contact for patients, and we have the opportunity to create that safe, non-judgmental space where they feel comfortable opening up.
You're absolutely right. We can also provide valuable education about sexual health, dispelling those myths and misconceptions that often contribute to shame or embarrassment. For instance, many men believe that erectile dysfunction is just a natural part of getting older. While the risk of ED does increase with age, it's not inevitable.
And we can't forget that some medications can actually cause sexual dysfunction as a side effect. So when we're reviewing a patient's medication list, we need to be aware of any potential impact on sexual function.
Absolutely. And if a patient does report sexual difficulties, we need to take those concerns seriously and look into all the possible causes. It might mean adjusting their dosage or even switching them to a different medication altogether.
So to wrap up our discussion on sexual dysfunction, we want to emphasize that it's common, it's treatable, and it's nothing to be ashamed of. Approaching these conversations with sensitivity and understanding, providing accurate information, and empowering patients to be acting in their care is key. And most importantly, we need to create a culture where men feel comfortable seeking help without fear of judgment.
Beautifully said. Now, let's shift gears and tackle a topic that often evokes fear and uncertainty: prostate cancer. It's the second most common cancer in men globally, and it can be a life-changing diagnosis.
It's definitely a complex disease with a wide range of treatment options and potential outcomes. So let's demystify prostate cancer a bit, exploring the risk factors, screening methods, and the latest advancements in treatment.
When we talk about prostate cancer, we're talking about the uncontrolled growth of cells in the prostate gland. As we discussed earlier, the prostate is that small, walnut-shaped gland located just below the bladder, surrounding the urethra. It plays a crucial role in producing semen, the fluid that carries sperm.
And while prostate cancer can be a very serious disease, it's important to remember that not all prostate cancers are the same. Some are very slow growing and may never cause any major problems, while others are more aggressive and can spread rapidly.
Exactly. And that variability in growth rate and aggressiveness is one of the challenges in managing prostate cancer. Decisions about treatment often depend on several factors, including the stage of the cancer, the patient's age and overall health, and their personal preferences.
So how do we determine the stage of prostate cancer? Is it similar to other cancers where higher numbers indicate more advanced disease?
You got it. Prostate cancer is also staged using a numerical system from stage I, the earliest stage, to stage IV, the most advanced. The stage helps us determine the best course of treatment and provides some insight into the potential prognosis.
And what about screening? We've already talked about the PSA test and how finasteride can affect its results, but are there other ways to screen for prostate cancer?
The PSA test is still considered the primary screening tool for prostate cancer, but it's important to remember that it's not perfect. It can sometimes give us false positives, meaning a man might have a high PSA level even without prostate cancer. And, as we've discussed, it can also give false negatives, where a man has prostate cancer but his PSA is normal.
So it's really just a starting point for further investigation.
Exactly. If a man has an elevated PSA, it doesn't automatically mean he has prostate cancer. We usually need further testing, like a prostate biopsy, to confirm the diagnosis. During a biopsy, a small sample of tissue is taken from the prostate and examined under a microscope for cancer cells.
I imagine a prostate biopsy can be a bit uncomfortable, both physically and emotionally.
You're not wrong. It's not the most pleasant procedure, but it's often necessary to get a definitive diagnosis and determine the best course of action.
So once prostate cancer is diagnosed, what are the treatment options?
Well, the treatment options for prostate cancer vary quite a bit, depending on the stage of the cancer, the patient's overall health, and their personal preferences. Some of the most common options include active surveillance, surgery, radiation therapy, hormone therapy, and chemotherapy.
Wow, so there's a whole range of approaches, from watchful waiting to more aggressive interventions. It sounds like choosing the right treatment plan can be a very personal and complex decision.
Absolutely. There's no one-size-fits-all approach. The best treatment plan often comes from thoughtful discussions between the patient, their doctor, and the entire healthcare team. It's a collaborative effort to determine what best meets the patient's individual needs and goals.
And this is where nurses play a vital role, providing support, education, and advocacy throughout the entire journey.
Precisely. We can help patients navigate the complexities of the healthcare system, understand their treatment options, and cope with the emotional and physical challenges that come with a prostate cancer diagnosis.
So, to summarize our discussion on prostate cancer, we want to emphasize that it's a complex disease with a range of possible outcomes. Early detection through screening is important, but it's crucial to remember that the PSA test isn't foolproof, and further testing may be needed. Treatment options vary widely and are often tailored to each individual's needs and preferences.
And as always, nurses play a critical role in providing compassionate care, education, and support throughout the process.
All right, let's lighten things up a bit now. Let's talk about hair loss. It's something that affects many men as they age and can be a real source of distress.
Ah, yes. The quest for a full head of hair. It's a pursuit that's been going on for centuries. But in today's world, we've made some real progress in understanding hair loss and developing treatments that can help.
We've already talked about finasteride and how it can be used for both BPH and male pattern baldness. But let's dive a little deeper into the world of hair loss treatments, exploring the options available and how they work.
Male pattern baldness, also known as androgenetic alopecia, is the most common type of hair loss in men. It's characterized by that receding hairline and thinning hair on the crown. As the name suggests, it's influenced by androgens, specifically DHT.
Right. We discuss how DHT plays a role in prostate growth, but it also contributes to something called hair follicle miniaturization. Basically, DHT can shrink those hair follicles, leading to thinner and shorter hairs over time.
Exactly. And that's where finasteride comes in. By blocking the conversion of testosterone to DHT, it can help slow down that miniaturization process and even promote hair regrowth in some men.
It's like a two-for-one deal, isn't it? Treating both BPH and hair loss with the same medication.
It is, and finasteride is generally well tolerated, although some men might experience side effects like decreased libido or erectile dysfunction.
Now, finasteride is one option for treating hair loss, but there's another medication we often use, minoxidil, also known as Rogaine.
Minoxidil is a topical medication that's applied directly to the scalp. It works by increasing blood flow to the hair follicles, which can help stimulate hair growth. Unlike finasteride, minoxidil doesn't affect DHT levels.
So it works through a completely different mechanism.
Exactly. We don't fully understand minoxidil's exact mechanism of action, but we believe it promotes the growth phase of the hair cycle.
And it's available over the counter, right? No prescription needed.
That's right. Minoxidil comes in both liquid and foam forms. It's generally safe and effective, but it can take a few months to see results.
Patience is definitely key when it comes to treating hair loss. Besides medications, are there any other options for men who are concerned about losing their hair?
There are a couple of other options, although they tend to be more invasive and costly. There's hair transplantation, where hair follicles are surgically moved from one area of the scalp to another, often used to restore hair to the front or the crown. And then there's low-level laser therapy, which uses laser light to stimulate hair growth. It's a relatively new treatment, and we're still learning about its long-term effectiveness.
So it sounds like there's a whole range of possibilities, from simple over-the-counter medications to more involved surgical procedures.
That's right. And the best approach for each patient depends on their individual needs, preferences, and budget.
And as always, nurses play an important role in educating and supporting patients considering hair loss treatments. We can help them understand the options, the potential benefits and risks, and the importance of having realistic expectations.
Well said. Now, let's transition to another common concern for men as they age. Low testosterone, also known as hypogonadism.
Low testosterone can really impact a man's physical and emotional well-being, causing everything from fatigue and decreased libido to mood swings and difficulty concentrating. So let's explore the causes, symptoms, and treatment options for this often overlooked condition.
When we talk about low testosterone, we're basically talking about a decline in testosterone production by the testes. Testosterone is the primary male sex hormone, and it's involved in a whole range of bodily functions. It's responsible for the development of those male sexual characteristics, like the penis, testes, and other reproductive organs. It also contributes to those secondary sexual characteristics we associate with men, like facial and body hair, muscle mass, and a deeper voice.
It's a pretty important hormone, and when those testosterone levels drop, it can really throw things off balance. What are some of the things that can cause low testosterone?
The most common cause is simply aging. As men get older, their testosterone levels naturally decline. But there are other factors that can contribute to low T, including testicular injury or disease, pituitary disorders, certain medications, chronic illnesses, and even lifestyle factors.
So it's not just about getting older. There are a whole lot of potential culprits. How do we know if a man has low testosterone? What are some of the telltale signs?
The symptoms of low testosterone can be quite diverse, and they often overlap with symptoms of other conditions. Some of the most common signs include fatigue, decreased libido, erectile dysfunction, mood swings, irritability, even depression. Some men also experience cognitive changes, like difficulty concentrating or remembering things, and there can be physical changes too, like decreased muscle mass, increased body fat, and even weaker bones.
Wow, it really does affect the whole body. It's easy to see how these symptoms could really impact a man's quality of life.
Absolutely, and it's important to remember that these symptoms aren't just a normal part of aging. They can signal an underlying medical condition that needs to be addressed.
So if a man is experiencing these symptoms, what should he do? How is low testosterone diagnosed?
The first step is to talk to a healthcare provider. They'll ask about the patient's symptoms, medical history, and lifestyle. They'll probably also do a physical exam. If low testosterone is suspected, a simple blood test can measure those testosterone levels. It's worth noting that testosterone levels fluctuate throughout the day, so the test is usually done in the morning when levels are typically highest.
And if the blood test confirms low testosterone, what are the treatment options?
The most common treatment is testosterone replacement therapy, which involves supplementing the body with testosterone to bring those levels back up to a normal range. There are several ways to administer testosterone replacement therapy, including injections, patches, gels, and implants.
It seems like there are a number of delivery methods, each with its own pros and cons.
Exactly. The best delivery method depends on the individual patient, their preferences, lifestyle, and medical history.
And what about the risks and side effects of testosterone replacement therapy? We've already discussed the black box warning about blood clots. Are there other things we need to watch out for?
Yes, testosterone replacement therapy can have some side effects like acne, fluid retention, and, in rare cases, breast enlargement. It can also worsen sleep apnea in men who already have it. And testosterone can stimulate prostate growth, which can worsen urinary symptoms in men with BPH. Finally, testosterone can increase red blood cell production, potentially leading to a condition called polycythemia, which can increase the risk of blood clots.
So it's not a risk-free treatment. Close monitoring and communication with the patient are essential.
Absolutely. And it's important to remember that testosterone replacement therapy isn't right for every man with low testosterone. For example, men with prostate cancer or breast cancer should not use it.
So to sum up our discussion on low testosterone, it's a treatable condition that can significantly impact a man's quality of life. If you're experiencing any of those symptoms we talked about, it's important to see your healthcare provider. They can help you figure out if testosterone replacement therapy is right for you and monitor you for any potential side effects.
And as always, nurses are vital in educating, supporting, and advocating for patients with low testosterone. We can help them understand their treatment options, manage those potential side effects, and live healthier, more fulfilling lives.
Well said. Now, let's transition to another crucial aspect of men's health: fertility. For many men, the ability to father a child is a deeply personal and important desire. But infertility can be a very challenging and emotional experience.
Infertility is defined as the inability to conceive after a year of regular, unprotected intercourse. It affects roughly 15% of couples, and in about half of those cases, male factors are involved.
That's a significant number. It really highlights the importance of understanding male infertility.
You're absolutely right. Male infertility can stem from a variety of factors, including problems with the sperm itself, like low sperm count, poor motility, or abnormal morphology. There can also be structural issues like a varicocele, which is an enlargement of veins in the scrotum, or blockages in the reproductive tract. Hormonal imbalances like low testosterone, genetic disorders, lifestyle factors like smoking and excessive alcohol use, and even exposure to environmental toxins can all play a role.
Wow, it's a pretty extensive list. It's easy to see how multiple factors could be involved in any given case. So how do we go about figuring out what's causing the infertility?
The first step is a thorough medical history and physical exam. The healthcare provider will ask about the patient's past medical history, lifestyle, and any previous fertility tests they've had. They'll also do a physical exam, paying close attention to the testes and scrotum.
I'm guessing a semen analysis is a key part of the process.
Absolutely. A semen analysis is a lab test that examines the physical characteristics of a man's semen, looking at things like volume, sperm count, motility, and morphology.
So we're looking for both quantity and quality when it comes to sperm.
Precisely. All of those factors are important for fertility. If the semen analysis shows any abnormalities, further testing might be needed to pinpoint the underlying cause.
And once the cause is identified, what are the treatment options for male infertility?
The treatment depends on the underlying cause. Sometimes, simple lifestyle modifications like quitting smoking, cutting back on alcohol, and maintaining a healthy weight can improve sperm quality and increase the chances of conception. Medications can be used to treat hormonal imbalances, infections, and other conditions that contribute to infertility. In some cases, surgery might be necessary to repair a varicocele, remove blockages in the reproductive tract, or correct other structural problems. And if other treatments haven't been successful, assisted reproductive technologies like in vitro fertilization, IVF, or intracytoplasmic sperm injection, ICSI, can help couples conceive.
It seems like there's a whole range of options available, from simple lifestyle changes to more complex medical interventions.
Exactly. The choice of treatment depends on the individual's needs, preferences, and the severity of their infertility.
And it's important to remember that infertility can be emotionally challenging for both men and their partners. Providing emotional support and counseling is an essential part of the care we provide.
Absolutely. We need to be sensitive to the emotional impact of infertility and create a safe, supportive environment where patients feel comfortable discussing their concerns.
So to wrap up our discussion on male infertility, it's a common and often treatable condition. If you're having trouble conceiving, don't hesitate to talk to your healthcare provider. They can help determine the underlying cause and recommend the most appropriate treatment options.
And, as always, nurses play a crucial role in providing compassionate care, education, and support throughout the journey of infertility.
That's a wonderful point, and it highlights the interconnectedness of all the topics we've covered today. Whether we're talking about prostate health, sexual function, or fertility, it's all part of the bigger picture of men's health.
Precisely. And as nurses, we have the privilege of supporting men's health throughout their lives, from adolescence to adulthood and beyond.
Well said. We'll take a short break now, and then we'll be back for the final segment of our deep dive into men's health essentials. Don't go anywhere. And we're back for the final part of our deep dive into men's health. It's been a pretty packed journey so far, hasn't it? We've covered everything from the anatomy of the male reproductive system to the complexities of infertility.
We sure have. But before we wrap up, I think it's important to circle back to something we've touched upon throughout our discussion: the crucial role nurses play in promoting men's health.
You're absolutely right. We've talked a lot about the medical side of things, but let's focus on what we as nurses can do to make a real difference in the lives of our male patients.
Nurses are often the first point of contact in the healthcare system, building those vital relationships with patients, providing education, and advocating for their needs. When it comes to men's health, we have a unique opportunity to break down those barriers and create an environment where men feel comfortable discussing their concerns openly.
It's about creating a space where those expectations of stoicism and self-reliance take a back seat, allowing men to actually prioritize their health without feeling judged or embarrassed. Let's face it, those expectations can sometimes prevent men from seeking help until a problem becomes much more serious.
Exactly. And that's where our proactive approach comes in. We need to engage men in conversations about their health, even when they don't come to us with specific complaints.
So how do we do that? How do we encourage those open dialogues and make men feel at ease sharing what's going on?
Well, it starts with creating a welcoming and judgment-free environment. Men need to know they can talk to us about those sensitive topics without feeling embarrassed or stigmatized.
Building that trust and rapport is essential. And of course, we need to be equipped with the knowledge to address their concerns effectively. Staying current on the latest research and recommendations from men's health insurers, we can provide accurate and evidence-based information.
Absolutely. Continuing education is crucial. But it's not just about having the knowledge, it's about how we communicate it. Asking open-ended questions and really listening to their answers can go a long way in encouraging men to open up.
And tailoring our approach to each individual patient. Not everyone learns the same way or responds to the same style of communication.
Personalized care is so important, and we can't forget about our role as advocates. We need to be strong voices for our patients, making sure they have access to the resources and support they need.
Speaking of support, I think it's important to remember that promoting men's health goes beyond addressing just physical ailments. Their emotional and mental well-being is just as important.
You're absolutely right, and this is an area where we can truly make a difference. Men are often hesitant to seek help for mental health issues, which can lead to delays in diagnosis and treatment. We can help break down those barriers by normalizing conversations about mental health.
It's about letting men know that it's okay to not be okay, and that asking for help is a sign of strength, not weakness. We can also incorporate routine mental health screenings into our assessments, using those standardized tools to identify potential issues early on.
Those screenings can be incredibly valuable, and if we do find a concern, we need to be ready to refer the patient to a qualified mental health professional. It's about ensuring they get the specialized care they need.
And it's not just about addressing problems, it's about promoting mental well-being. We can encourage men to participate in activities that are good for their mental health, like regular exercise.
Exercise is fantastic for stress reduction, mood improvement, and self-esteem. And let's not forget about mindfulness practices like meditation and yoga, which can help reduce anxiety and promote relaxation.
And of course, those strong social connections are so important. We can encourage men to stay connected with family and friends, participate in hobbies. They enjoy things that bring them joy and a sense of belonging.
It all comes back to that holistic approach we've been talking about, considering all aspects of a man's life and experiences. And it's about empowering them to take an active role in their own health, both physically and mentally.
It's a partnership, and as nurses, we're lucky to be a part of that journey. As we conclude this deep dive into men's health, remember that it's a complex, multifaceted, and deeply personal aspect of care. There's no one-size-fits-all approach. Every man's needs and experiences are unique.
We as nurses have this incredible opportunity to advocate for our male patients, to provide compassionate, evidence-based care, and to empower them to make informed decisions about their health.
Never underestimate the power of simply listening, validating their concerns, and offering a supportive presence. Those seemingly small gestures can have a huge impact.
We've covered a lot of ground today, but our exploration of men's health doesn't end here. Keep learning, keep asking questions, and keep advocating for your patients' well-being.
Thank you for joining us on the Vital Signpost. We hope you found this deep dive informative and empowering. Until next time, keep those vital signs strong.